All right, again, want to welcome everybody. My name is Dr. Roz. I am here with our Time to Tell the Truth series. It's been a weekly series. We've got 52 weeks. God told me to do this for 52 weeks. We're a little bit more than halfway through that at this particular time. We're also, live on Facebook. We just want to get this message out. I want to share the information because oftentimes we just don't do the research. So I'm just committed to researching and listening and reading and hearing a bunch of people share their take on this so that we can put it all together in one place and see if we can get some answers regarding high blood pressure, diabetes, dementia, all the stuff we've been talking about. So if you've missed any of those, all you got to do is go to my YouTube channel and subscribe, and you'll constantly get this information. Again, my name is Dr. Rosalind Shaw Belt. Everybody calls me Dr. Roz. I am the CEO of Dream to Life Productions Ministry, LLC, and getting ready to launch a nonprofit because my goal as a wellness coach is to get the word out about information so that we have choices. I'm a wife, I'm a musician. I do a bunch of other stuff, but here, what I want to focus on is being a certified wellness coach. I have a certificate, a certified econopreneur and lifestyle consultant certification, as well as a certified wellness coach through our Dr. Eric Prince, who is our naturopathic doctor and here at Akana. But today, let's talk about CKD. Yeah, that's the three-letter that we use for chronic kidney disease.
Good health makes a good life possible, and healthy kidneys are important to your overall health. Your kidneys filter waste out of your blood, so when they get damaged, waste can build up in your body and make you sick. Chronic kidney disease, or CKD, is when you have lasting damage to your kidneys that can get worse over time. If the damage is severe, your kidneys may stop working. This is called kidney failure, and it means you will need dialysis or a kidney transplant to live. If you have diabetes, high blood pressure, or a family history of CKD, ask your doctor to do a blood and urine test to measure how well your kidneys are working. Chronic kidney disease has 5 stages. The goal at each stage of CKD is to slow down damage to your kidneys and keep them working as long as possible. In the first 2 stages, you might not even know you have kidney disease. You might feel totally normal. At this stage, making healthy lifestyle choices and taking your medicines as prescribed can help prevent further damage. In stage 3, you have mild to moderate damage to your kidneys, and they aren't working as well as they should be. You might start to feel weak and tired, or have swelling in your hands and feet, or notice your urine looks foamy or darker than usual. With treatment and healthy lifestyle changes, many people in stage 3 do not move on to stage 4 or stage 5. To slow the progression of your disease, see your doctor regularly and talk about any changes to your labs or symptoms you're experiencing. Ask for a referral to a kidney doctor and meet with a renal dietitian. In stage 4 of CKD, your kidneys are moderately to severely damaged, and you might experience swelling in your hands and feet, or pain in your lower back, foamy or darker urine, or a change in how often you urinate. Stage 4 is the last stage before kidney failure. At this stage, it's important to work with your healthcare team to slow down kidney damage and plan ahead. Build a support network and learn about different treatment options. And stage 5 means your kidneys are about to or have already stopped working. At this stage, you'll need treatment like dialysis or a kidney transplant to prolong your life. Work with a kidney doctor to determine which treatment option is best for your lifestyle. The good news is, if caught early, there are steps you can take to slow or prevent damage to your kidneys, and living a healthy lifestyle will help you feel your best. Talk to your care provider about medications and lifestyle changes to support your kidney health. Get to know your kidneys at kidneyfund.org/knowyourkidneys.
So here's the thing, guys. I knew I was going to talk on this Saturday, and what took it to a whole other level, we were having our weekly community check-in where we come together as a community when people are deciding that they want to do a detox. And one of the gentlemen came on there who was on dialysis. Did you hear me say was, past tense? And he gave his testimony about how he got from 50 down to 30, and all of these things that he no longer has, from high blood pressure to diabetes. And it was all because he has begun a regimen every month, or every month, doing a 7-day detox, and he's changed his diet. If that didn't fire me up, nothing fired me up. That fired me up even more, because now I had a real person that I personally knew and that was a part of our team that has put the work in and is improving his kidneys. When everybody says it's not reversible and all the things that people are saying, but when we put the work in. So let's talk about the stages first, because it's all about preventative. And if nobody gives us this information, we don't even know what to do as a people, that we may be progressing, and then they tell you you've got it when you're in stage 4, or they tell you you've got it when you've got to go to dialysis. So if you're on here today and you've got somebody who is on dialysis, we're going to show you things that they can do that can possibly improve. They say it can't be reversed, but I'm seeing these things happen in people's lives. All I can go on is the testimony. So we don't make the claims, but we can hear the testimonies. Stage 1, you don't even know you're in stage 1. But I'm going to show you how you can know you're in stage 1. One of the things that we do here as a certified wellness coach is that we do bioscans, and kidneys is one of those functions to show you the progression of the disease way before it becomes critical. But in stage 1, your kidney is still pretty normal. The GFR is 90 or above. However, you might have some physical signs such as protein in the urine. That's something that shows up on our bioscan. So, but often there are no noticeable symptoms in stage 1 of CKD, which is why it's commonly undiagnosed when you go to the doctor. That's what I love about the bioscan. It does what we don't see when we walk through the doctor's office. Although they want us to do routine health screenings, they may detect early damage, but most of the time people never recognize it when they go to the doctor, like sometimes even with diabetes and high blood pressure. But if you're diabetic, if you have high blood pressure, then guess what? You're going to find out some information regarding kidney disease. In the long run, longevity, but it's reversible, guys. Stage 2, still relatively close to normal, although there might be some evidence. It's generally mild. Most people with stage 2 experience few or, if any, symptoms. But when symptoms do occur, they may include fatigue, changes in urination, or mild swelling. Stage 3, the kidneys have declined significantly, and you're starting to experience things like fatigue, swelling in your hands, ankles, or feet. Now, when I say this, it's not to alarm anybody. It's just to make us aware that when your hands and your ankles and your feet start swelling, it's not just not doing it for no reason at all. We're so quick to grab some medication and don't recognize we see symptoms. Our body is so wonderfully made. It's the way God made it. And he made us so wonderful that when things change or things happen, there are symptoms that we need to address. Back pain, flank pain, changes in your urination frequency and appearance, and muscle cramps. And then stage 4, that's severe decline. Significantly fatigued, swelling in the extremities and face, changes in your appetite, your nausea, your vomiting, metallic taste in the mouth. People experience these things and ignore them, not recognizing that they can do something about it at that point. And then stage 5, which is called ESRD, end-stage renal disease. That's the final stage, the most severe stage, and the kidneys no longer perform. So what? You now have to be put on a dialysis machine to do the performance for you until you can get a kidney transplant. So we want to move forward. And I'm going to show you, at least by the end of this, some testimonies of somebody who says they did necessary things and they are seeing it reverse, or they're either stopping it in its tracks.
Hello, my name's Jeremy Levy, and I'm a consultant nephrologist, a kidney specialist, and I work at Imperial College Healthcare. And I look after a lot of patients with kidney diseases of all sorts. So most people with early CKD have very few symptoms, and if you're at all concerned you might have this, then it's important to go to your GP to get a blood and urine test to make a diagnosis. So what causes chronic kidney disease? Well, for most people it's caused by something else, and usually that's diabetes, high blood pressure or high cholesterol. In diabetes, high blood sugar or blood glucose makes the filtering units in the kidney get blocked up and work less well, and also affects the blood vessels. In high blood pressure or people with high cholesterol, again the blood vessels in the kidney tend to get narrowed and furred up, which makes the kidneys less good at getting rid of waste products. There are also other conditions, and much more rarely some inflammatory diseases where there is inflammation in the kidney, sometimes called glomerulonephritis, can also attack the kidneys and cause chronic kidney disease. And there's one actually very common inherited disease called polycystic kidney disease, which can cause chronic kidney disease and slowly progressive damage. And that's actually quite common in England and many other countries around the world. Up to 10% of people may have this disease, polycystic kidney disease, causing their CKD. Blockages in the kidney, for example caused by kidney stones, can also lead to CKD, but this is more unusual. And finally, long-term use of some medicines can lead to slowly progressive chronic damage. Medicines such as lithium or long-term use of anti-inflammatory painkillers, sometimes ibuprofen or Nurofen, but you have to be taking these for a long time, and if you need them for other conditions, should have regular blood tests done by your GP or other specialist. Chronic kidney disease is diagnosed by a blood test, and the critical blood test is called a creatinine and sometimes a GFR, and almost always needs a urine test at the same time, particularly to look for blood or protein in the urine. The GFR number tells us roughly the percentage of kidney function. Very bad kidneys, stage 5 CKD, is when the GFR number is less than 15, which roughly translates to 15% kidney function. As I said, this is not the commonest form. Most people with CKD have CKD stage 3, and that's when the kidney function, this GFR number, is between 30 and 60, representing about 30 to 60% kidney function. And stage 4 is when the kidneys are working between 15 and 30. So the GFR number, really important number to monitor your kidney function and the test that a doctor will do to see if you have CKD. All people with other conditions that can lead to kidney damage, such as diabetes and high blood pressure, should be having their kidney function monitored by a blood and urine test intermittently. Now this might be once a year, but if you already have kidney disease, it might be every 6 months.
Now I want to stop for a minute because I've got a couple of videos that I want to get to, and they're pretty long. I don't usually play long videos, but I started listening and I just couldn't interrupt it anywhere. A lot of causes. Now, when we see the causes of CKD or chronic kidney disease, the question comes to mind, if we can do something about the cause, we can do something about kidney disease. So that's why I say, when people say it's not reversible, I have a problem with that, because if I find out, and maybe by the time you get to stage 4, maybe that's true, but I'm seeing that happen in people's lives, but he just said most people, when it's diagnosed, they're at stage 3. If they're at stage 3, meaning that they have diabetes, they have high blood pressure, maybe there's a genetic condition, maybe there's an autoimmune disease, maybe there's a kidney stone, or maybe there's just obesity. Well, something can be done about all of this. All of this can be reversed. So there is hope, guys. That person in your life, and even yourself, if you are diabetic, if you've got high blood pressure, you have some things going on, you've not been diagnosed for kidney disease, but I need you to understand today that prolonged being a diabetic, prolonged being a person with high blood pressure on the medication, we're going to talk about even the medication that's leading us to kidney disease. My father died being on dialysis. And he was a person that drank water. People say, oh, you didn't drink enough water. He drank water all the time. But he was on high blood pressure medicine all of his adult life. And we're gonna have somebody talk about that in a few minutes.
Ever wondered what causes kidney disease? Well, let's talk about that today. Stay tuned. Thanks so much for watching. Make sure you subscribe to my channel. Like this video, click that bell so you never miss a new recipe or a new health tip. My name is Dr. Blake Schusterman. I'm a board-certified kidney doctor, and I'm also the cooking doc. And everything we talk about here today is just for information only. This is not medical advice. Okay, so today we're going to get real basic, no food, just kidneys. Kidney disease affects 37 million Americans, and many millions more are at risk. It also affects hundreds of millions of people worldwide. If kidney disease is diagnosed early in its presentation, oftentimes the progression of the disease can be slowed through medications, through diet, through lifestyle changes. So it's really important to know what causes kidney disease and to make sure that you are being screened if you are at risk for it. The number one cause of kidney disease is diabetes. Diabetes is a disease that can affect almost every organ in the body. The damage to the kidneys from diabetes usually occurs slowly over a prolonged period of time. So if you have diabetes, you know that you are at risk for kidney disease and that diabetes is the number one cause of kidney failure. So that means you need to be extra careful about your diabetes, and you need to make sure that your doctor is monitoring your kidneys and screening you for kidney disease as soon as you have a diagnosis of diabetes.
Now, I want to stop that for a minute because he said it's the number one, diabetes is the number one, and he said the doctor should be monitoring that. You know, here's what the doctor should be doing: telling you how to stop being a diabetic, telling you something about nutrition that can cause your A1C numbers to get in check, not necessarily putting you on medication only. Now, I'm not saying against medication. I am just saying it should not be your only choice. And here at Time to Tell the Truth, I want you to know you have other choices. Black Americans are highly ranked as it relates to kidney disease because so many are diabetic, so many have high blood pressure. 20% of Blacks do not have health insurance. Blacks are less likely to receive referrals to specialists who conduct a pre-transplant evaluation. Blacks are 4 times more likely than white Americans to have kidney failure. 13.2% of Black adults have been diagnosed with diabetes. High blood pressure occurs in 1 out of 3. Do you get this? You can sit in a room with 3 African Americans, and one of them is going to have high blood pressure. Why is that? Oh, you know, it's because of our diet. We've talked about this. We've talked about how we can conquer high blood pressure with food. And many Blacks may be unaware that untreated high blood pressure can lead to kidney disease. When you go to the doctor and the doctor says you have high blood pressure, or it says you are diabetic, or your A1C is off the chain, there's not a statement behind that that says, and you're leading towards kidney disease. No, because I have people tell me all the time, I'm a diabetic or I have high blood pressure, but they never say, and I'm headed towards kidney disease. Well, I came to tell you the truth. If you don't do anything about your blood pressure, if you don't do anything about your diabetes, you're headed towards kidney disease. I didn't just say it, the doctor said it. I'm not a medical doctor. I'm a certified wellness coach. I've got 2 doctorates, theology and divinity, but they give me the urgency and the passion as it relates to ministry to get the word out, because we are destroyed for the lack of knowledge. The average number of prescriptions that are filled annually for adults, look at this. I mean, they're loading us up with prescription drugs. We talked about drugs last week in our presentation and how so many different drugs are leading us down the path of destruction. Big Pharma and all the pharmaceutical things and all the pharmaceutical companies are making money off our pain, and we've got to take control of our own lives. I'm saying you need to have a conversation with your doctor. You need to take control of your own self and say, look, doc, I'm going to do this. I'm going to detox. I'm going to get off these pills at some point. Oh, yeah, they tell you got to take them for the rest of your life. But no, we've got to begin to take control of our lives. The average annual prescription expenditure, they're making money off of our pain. Look at these. Okay, here's some drugs. Now, you see them on television. I meant to count the other day. It might have been when I was watching the World Series. I can't remember. I was watching something. And I meant to count how many times they interrupted my TV show with a drug commercial. I dare you to check it out. For those of you that watch television, the next time you watch it, sit there and find out how many times you get a. Do you know that in other countries, it's against the law to have a commercial about drugs? Because see, commercials are designed, and I've taught this before, the purpose of a commercial is to solicit something that you can buy. You can't go and buy these drugs. Keytruda, Ozempic, Mounjaro. I mean, you've seen them. You can't go buy them. They have to be prescribed. So then what's the purpose of the commercial? The purpose of the commercial then is to make me say, maybe that'll work because all these people are looking so good in this commercial. Keytruda, top selling drug. The drug induces some side effects, including causing the immune system to attack other parts of the body, even after the medication has ceased. And it can cause your immune system, watch this, we've talked about the immune system, how it's supposed to ward off and be a fighter against other things that may attack your body. But when you're on Keytruda, it can cause your immune system to attack normal organs and tissues. Ozempic, oh my God, how popular has it become? I'm so glad Akana just came out with something that can go completely contrary to Ozempic and still help you with lowering your blood sugar and weight loss and all these things. But this one here, we've got celebrities using it. But look at the side effects: low blood sugar, inflammation of the pancreas, gallbladder problems, thyroid tumors, including cancer, kidney problems, kidney failure, serious allergic reactions. And here's the thing, it doesn't do this immediately, but it does it over time. Eliquis prevents blood clots from forming in patients with deep vein thrombosis or in patients with an irregular heartbeat. But look at the side effects: bleeding, anemia, low blood pressure, nausea. Oh my God, the list goes on and on. Humira, I've seen that one. I've seen that commercial. Trulicity, I've seen that commercial. So all of these medications, these are popular medications right now. But I want to share with you this doctor, and this video's a little lengthy, and initially I kind of chopped it up, but then as I thought about it today, I said, no, I'm playing the whole thing. So I hope you can sit through this and hear it without hearing me talk. All right, here we go.
I'm Dr. Frida, and today I'm giving you 9 common medications and drugs that can cause kidney damage. Are you at risk? Do you ever take medicines for pain, fever, for infection? So medications are good in many ways, definitely. They help us to treat pain, to treat fever. They help us with infections. They help us to treat cancer. They're helpful in many ways. I prescribe medications. However, there are definitely medications that can lead to serious kidney damage and even the need for dialysis. Sure, some of these medications that are harmful to the kidneys are ones that you're purchasing over the counter. But guess what? Sometimes the medications can be being prescribed to you by your doctor. I know, that's scary. But that's the point in being your own advocate and collecting information from sources you trust. Today, we're going to talk about it. I'm going to let you know if some of the pain meds you're taking, the antibiotics, maybe even the chemotherapy could actually be damaging your kidneys and what to do about it. Keep watching. Would you like my undivided attention as we discuss your specific medical journey? If so, you are in luck because I offer a concierge telehealth service where you can get my direct input on your health concerns. Be sure to click the link below. I'm Dr. Frida. I'm a board certified kidney doctor, and I want you to please go ahead and like this video and subscribe to my channel so you'll be among the first to know when I release information. And let me tell you, I give you evidence-based medical information on this channel in a way that's easy to understand. And that's exactly what I'm about to do right now, because I'm giving you 9 common medications and drugs that can cause kidney damage, some of which you might actually be taking. In addition to the specific kidney health information I'm giving you today, I give lots of general health information on this channel. And in fact, I have a freebie for you. I want you to go ahead and download a free PDF. Click the link in my description. I'll give you 10 healthy habits for a better you and a better life. As you listen to this list I'm about to give you of the medications that can cause kidney damage, I want you to pay attention and tell me which ones surprise you. Put it in the comments below. I'm really interested in finding out. Number 1, non-steroidal anti-inflammatory drugs, or NSAIDs. Yes, I'm talking about some common pain medicines like ibuprofen, naproxen, aspirin. Raise your hand if you take these medications. Well, these meds are excellent for pain and for inflammation. Lots of people who are having sports injuries or arthritis or menstrual pain will take NSAIDs. It's very common. But what you may not know is that NSAIDs, in some cases, can actually cause kidney failure. And I've actually dialyzed patients as a kidney doctor because of NSAID nephropathy. In other words, patients who normally would not have had kidney failure have ended up on my dialysis machine just because they've taken too much ibuprofen. It's true. Now, I do want to say, I'm not demonizing NSAIDs. There are some people with very healthy kidneys who are very hydrated who can take NSAIDs as prescribed and be fine. However, if you are vulnerable or if you already have CKD, chronic kidney disease, then NSAIDs may not be for you, or certainly you may need to be careful with the dosage. So let's talk about it. The way that NSAIDs work, yes, they're anti-inflammatory, they help with pain, but they also can decrease the blood flow to your kidneys. And in doing that, they can decrease how your kidneys filter out excess toxins and excess waste. So what this can do is lead to an acute kidney injury or even a chronic kidney disease. It can cause you to have an increased serum creatinine, a decreased eGFR, or estimated glomerular filtration rate, and in some cases, it can even cause a chronic interstitial nephritis. NSAIDs can even cause an issue with the way that you get rid of excess fluid. It can lead to edema. So how do you know if you're someone whose kidneys may have been damaged by NSAIDs? Well, first off, you want to consult with your doctor. Find out what your kidney function is. Find out what your eGFR is, what your serum creatinine is. Find out if you have excess protein in your urine. Then talk about the dosages of NSAIDs you've been taking. Have you been taking high-dose ibuprofen, like 800 milligrams 3 times a day? Has your orthopedic doctor ordered you to do that? Well, it's possible that this is okay for you for the short term, but if you're doing it for more than 10 days, or if you're doing it regularly, especially if dehydrated, it could be causing an NSAID nephropathy or an NSAID kidney disease. Are you taking medications for more than 10 days for pain or more than 3 days for fever? If so, you could be at risk. Are you taking a combination of pills, like some of these powders that have aspirin, acetaminophen, and caffeine? Okay, are you someone who likes to chug down a powder for pain? If so, you could be damaging your kidneys. So what you want to do is, even for over-the-counter medications like NSAIDs, you want to consult with your doctor. You want to use the medication as prescribed, and you want to make sure that you are properly hydrated if taking NSAIDs. And if you are a person who already has vulnerable kidneys, or if you're taking another medication that can also damage your kidneys, then NSAIDs might not be for you. Oh, when it comes to aspirin, your doctor may have told you to take a low-dose aspirin, like an 81 milligram aspirin. If you're listening to this video, don't all of a sudden toss your aspirin to the side. Consult with your physician, because in most cases, the low-dose aspirin may not cause a problem. But if you're taking a high dose, or if you already have very vulnerable kidneys, then again, they might not be for you. 2, antibiotics. Now, I'm sure we've all taken antibiotics to help us with infections, right? If you've had a strep throat, or if you've had an infected wound of some sort, if you've had pneumonia, you've probably taken antibiotics. However, there are certain antibiotics and certain antibiotic doses which can cause harm to the kidneys. Specifically, there are certain antibiotics like gentamicin or vancomycin, or even certain antifungals that can cause kidney damage, especially when they're given IV and in the hospital, and if you already have compromised kidneys. How do you know? You have to be your own advocate or be your loved one's advocate. If you find out that you're being prescribed an antibiotic and you know that you have kidney disease, or if you're just concerned that you could be vulnerable, ask your doctor, can this antibiotic harm my kidney? And if the answer is yes, you want to find out alternatives or what you can do to prevent the damage. For some of the IV antibiotics given in the hospital, for example, like the vancomycin or maybe the gentamicin, there are teams that will go through and dose the medications in ways that are safe for the kidney, and they'll monitor the levels. But you want to make sure you ask these questions and be your own advocate. And then there are even antibiotics that can be given as an outpatient that can be harmful to the kidneys. One, Bactrim, and you know that's a common one. It's actually an excellent medication for preventing a lot of infections and being taken prophylactically, and certainly for treating infections. However, if you already have vulnerable kidneys, or if you're dehydrated, or if you have CKD, then something as simple as Bactrim can make your kidneys worse. Talk to your doctor. The Bactrim can increase your serum creatinine. Also, certain antiviral medications can cause crystals in the kidneys, which can lead to blockage and decreased kidney function. So if you're being treated for a virus, ask your doctor if the medication can harm your kidneys. And if so, again, see what you can do to prevent it. Make sure that you're well hydrated, ask for the alternatives, and ask if you need alternate dosing depending on your kidney function or if you have CKD. Oh, and yes, there are certain HIV medications that can cause kidney damage as well. Be sure to watch my YouTube video on CKD stages after you finish watching this video. Number 3, now this one might get you. ACE inhibitors, medications like lisinopril, enalapril, benazepril. Yes, these medications can cause kidney damage. Let me know in the comments if you've ever been prescribed an ACE inhibitor or if you're taking it. Now listen, again, I'm not demonizing ACE inhibitors. These are actually excellent medications for certain people. ACE inhibitors like the lisinopril can be good for your heart health, and even in early stages of kidney disease, especially diabetic nephropathy. Medications like the lisinopril, the benazepril, these medications can help to decrease the protein in your urine, which actually can be helpful for your kidney health. That's in the beginning, early stages of nephropathy. However, as the kidney disease progresses, or if you have certain blockages in your kidney arteries or in your kidney vasculature, or if you're dehydrated, if you have low blood volume, these ACE inhibitors can actually lead to kidney damage and kidney failure. It's true. So what do? If you're being prescribed an ACE inhibitor like the lisinopril, ask your doctor, okay, will this be helpful to my kidneys? In other words, is it an early stage? Do I have early diabetic nephropathy? And then say, will this be harmful? And here's one of the things you can do. Request that your doctor, if they're giving you lisinopril, request that they check your kidney function before giving you the ACE inhibitor and then 2 weeks after. If you have a marked or a significant decrease in your kidney function, then the ACE inhibitor might not be for you. And I would request that your doctor see if you have some type of a blockage in your kidney arteries. Do you have some type of a renal artery stenosis? That's very important. Also, if you already have advanced kidney disease like CKD3, CKD4, have that conversation. And actually, if you're not already seeing a kidney doctor, ask that your primary doctor refer you to a nephrologist like me, because we are able to go in and really have some great insight on which medications are helpful and which ones are harmful. Other things that the ACE inhibitors can do is that they can have a side effect of giving you a high potassium in your blood or hyperkalemia. And having high potassium can lead to serious heart problems like abnormal heart rhythms. It can even cause your heart to stop if you have super high potassium. And yes, all of these things can be side effects of ACE inhibitors. So again, ACE inhibitors can be wonderful blood pressure medicines. They can be heart protective, even kidney protective early on, but they can also cause your kidneys to have a perceived low blood volume. And for certain patients, they can lead to kidney damage. 4, diuretics. Now this is a big one. Water pills. Have any of you taken water pills? Yes, water pills can be very helpful if you're someone who's got a lot of bloating or edema, or if you have heart failure, or even if you have lung disease where you have excess fluid in your lungs. Then these diuretics like furosemide or Lasix, hydrochlorothiazide, spironolactone even, these can be really helpful in getting rid of the excess fluid in your body. However, in some cases, these diuretics can lead to dehydration, which can lead to kidney damage or something called pre-renal azotemia. These diuretics can also possibly lead to more long-term kidney damage, even leading you to needing dialysis, especially if you're taking high doses, high-dose IV diuretics, and if you're taking them for a prolonged period of time where you've been dehydrated for a prolonged period of time. So it's important that you talk to your doctor about monitoring your kidney function. Sometimes it's a tricky balance. You don't want to have fluid overload. You don't want to stress your heart, especially if you have congestive heart failure. You don't want to have a shortness of breath if you have lung disease and you have too much fluid in your lungs. But you don't want to be over diuresed or have too much of the water pill because, again, it can lead to kidney failure. So what you need to do is to have candid conversations with your doctor. If you're on a water pill, ask them how they're monitoring you. They should be checking your kidney function regularly with that BUN, with that creatinine, with the EGFR to make sure that the diuretics are not harmful to you. Also, you want to find out certain side effects. Certain diuretics can cause you to have high calcium in your blood, or high blood sugar, or high uric acid, specifically the hydrochlorothiazide. Talk to your doctor. Again, diuretics are important. I prescribe diuretics to my patients, even to some of my kidney patients, but it's important that you're being monitored by someone who knows what they're talking about. Because yes, diuretics, these water pills, in some cases, can lead to kidney damage. 5 angiotensin receptor blockers, or ARBs. I'm talking about losartan, valsartan. Oh, do those sound familiar? They might, because these are very commonly prescribed blood pressure medications. Heart doctors love to prescribe them. Kidney doctors love to prescribe them. But you must beware because, again, they can cause kidney damage in some patients. So here's the thing. Some of you may have been prescribed an ACE inhibitor in the past. We already talked about those, like the lisinopril, but you may have developed a cough, okay? A really bad, annoying cough. So your doctor said, oh, you can't take the ACE inhibitor, take this ARB. So now they've prescribed you losartan, the cough is gone, you think everything is great. However, if you're someone who already has advanced kidney disease, or if you have a low blood volume and you're dehydrated, then it's possible that the ARBs can actually hasten the progression of your kidney disease. In other words, they can take kidneys that are already vulnerable and make them much worse and even send you into kidney failure. So if you're taking an angiotensin receptor blocker, an ARB like losartan or valsartan, talk to your doctor because in some cases, if your kidneys are vulnerable, it could cause you to have kidney failure. Remember, I'm not demonizing all of these medicines. Even I prescribe ACE inhibitors to certain patients. I prescribe angiotensin receptor blockers to some patients. But again, your kidneys must be monitored and you have to be your own advocate. Question, have you or anyone you know experienced kidney damage due to some of these medications or drugs I've mentioned? If so, please share your story in the comments. 6.
So what I want you to do as you're hearing this, as we've gone through 1, 2, 3, 4, and 5, put in the chat if you are one of those persons or know somebody who has done any of those, put the one that rings to you, the number 1, 2, 3, 4, 5. And so now we can go back and we can do something about it.
Chemotherapy agents. Now this is a big one because sometimes it's really a catch-22. If you have certain malignancies or certain cancers, then yes, the treatment of choice is also chemotherapy, but it must be balanced because certain agents like cisplatin, methotrexate can cause kidney damage, especially if your kidneys are already vulnerable. So when you're talking to your oncologist or the person who's prescribing you a chemotherapeutic agent, you want to A, make sure that they're monitoring your kidney function, B, make sure that you remain well hydrated, and C, ask for alternatives. There are oftentimes chemotherapy alternatives that may not be as nephrotoxic or poisonous to the kidneys as some. It's a balancing act. Life is a balancing act. But it's important that I at least make you aware that as a kidney doctor, I have seen patients who develop kidney failure and who even start to need dialysis because of the chemotherapy they're on. So it's important that you talk to an oncologist you trust, a physician you trust, find out all of the pros and cons of whatever chemotherapy you're on, find out if it's possible that it can cause kidney damage, and make sure that you're taking a chemotherapy or whatever treatment for your cancer where the benefits outweigh the risks. Because yes, some chemotherapy can lead to kidney damage. 7, imaging contrast dyes. Ooh, I can't tell you how many times I have been a physician in the hospital and I've been called to see a patient for a nephrology consult because they got contrast nephropathy. In other words, they've gone to get an imaging study like a CT scan with contrast, and they developed kidney failure as a result. I've had to put patients on dialysis. Now, granted, most patients who get these CT scans, even with the IV contrast, most do fine. But again, there is a such thing as nephrotoxicity or poison to the kidneys caused by these IV iodine contrast dyes. Now, it's important to know if you're at risk. If you have perfectly healthy kidneys and you're very hydrated, then chances are you'll do pretty well with the IV contrast. And the radiology team, the radiologists, they actually do look at your kidney function before you're getting IV contrast. But as always, you want to be your own advocate and know your own kidney function so you can ask the right questions. If you're someone who has chronic kidney disease like CKD3, CKD4, or if you're someone who's very dehydrated, or if you're septic, or if you have a low blood volume, or if you're already taking one of these other medications I've mentioned that can cause kidney damage, then if you're getting an IV contrast dye, then it's possible that it can send you into kidney failure or at least cause kidney damage. You want to ask the questions. Don't be shy, be bold, be your own advocate. It is your right to ask your physicians questions. Here are some things you can do to prevent contrast dyes leading to kidney damage. 1, be very well hydrated. For most people, most adults, that might be 3/4 of a gallon of water a day, or 2 to 3 liters of water a day. Or if you're thinking about those 16-ounce bottles of water, that might be 4 to 6 bottles of water a day. Consult with your physician to find out how much water is safe for you to be well hydrated. Also, be sure to watch my video on the importance of drinking water for kidney health after you finish watching this video. Also, if you know that you really have to have the study or your doctor feels very strongly that the study with contrast is going to help your health or to help to make a proper diagnosis, then ask about receiving IV hydration, okay? Getting IV fluids through your vein intravenously. Getting the IV fluids before you receive the dye and after you receive the dye can oftentimes help to prevent contrast nephropathy, that kidney damage from the dye. In some cases, if you already have advanced kidney disease, but it really is imperative that you have the contrast dye, if it's really important that your doctor uses that dye, then in some cases, and I've done this before, you may actually have to have a temporary or a transient dialysis just to quickly get the dye out of your system. And in many cases, in most cases, when I've had to do that, the patients don't require long-term dialysis right away. The point is, again, you always want to arm yourself with knowledge. And that's the purpose of me sharing this information with you, so you can have these candid conversations. Because yes, IV contrast dye can lead to kidney damage. Oh, yes, there are alternatives. You want to ask, do I have to have contrast, or can I have a CT scan without contrast? Do I have to have contrast, or can we do something like an ultrasound, or can we do an MRI? Where that gadolinium can cause a different kind of a risk, in some cases a lower risk. Ask for the alternatives in imaging, okay? If it's suspected that you have a PE or pulmonary embolism, perhaps you can get a VQ scan instead of having contrast dye. Be your own advocate, talk to your physicians.
I want to ask this question. I want you to put in the chat 1 for yes, 2 for no. If you have been on any of these medications, high blood pressure, diabetes, and if your doctor has continued reminded you and stressed the need for you to stay hydrated. Put a 1 if they have, yes. 2 if they never mention it. Okay? She said this over and over again about being hydrated. Even if you're on these medications, we need to be hydrated. Is the doctor even mentioning it or just telling you just to take the pills? I sit down with my Medicare clients and they've got 5, 10, 15, 20 different medications. But now I'm going to start asking them, how much water are you drinking?
8, certain mood stabilizers can cause kidney damage. I can tell you this right now, as a kidney doctor, I have seen this time and time again throughout my career. So what do I mean by mood stabilizers? Well, patients with certain mental conditions such as bipolar disorder may need mood stabilizers, right? To help to balance them out, to keep them from being manic and to keep them from being super depressed, right? One of these mood stabilizers is lithium. And I have patients where lithium works really, really well for them to have a good quality of life and not to have these manic episodes or major depressive episodes. It helps to stabilize the mood. Well, one of the negative things about lithium is that it can cause kidney disease. It can cause thyroid disease in some patients as well. So it's important that the dose is monitored. And if you're a patient who's taking it, or if you have a loved one who's taking the lithium, you want to make sure that that kidney function is measured on a regular basis. Don't just be on the lithium and have your psychiatrist to keep increasing the dose without checking that BUN, that creatinine, the EGFR. What are the alternatives? Well, this is what I do with my patients. Sometimes if they're on lithium and it's starting to cause kidney disease, the first thing I'll do is find out from the mental health care provider, the psychiatrist, if there is an alternative, because lithium is not the only mood stabilizer. And oftentimes when my patients have kidney disease from lithium, we really can find other mood stabilizers that are not harmful to the kidneys. So that's a pretty good solution. But I have some patients where the lithium is really the only thing that works well for them. And we've tried other mood stabilizers, and with them, they may hit a major depression or even hit manic episodes that cause them to not really function well in society and not have good quality of life. In those patients, I oftentimes have to really lower the dose of lithium, make sure they're well hydrated, make sure they maintain good blood sugar levels, make sure they maintain good blood pressure levels. And sometimes we have to have another mood stabilizer in conjunction with the lithium so we can have the lowest, safest amount. The point is that if you're taking a mood stabilizer, specifically lithium, again, be your own advocate, because lithium in some cases can cause kidney damage. 9, alcohol and illicit drugs can cause kidney damage. For the alcohol, if it's taken in excessive amounts especially, it can lead to hypertension, which is the number 2 cause of kidney failure. And then illicit drugs like cocaine, heroin, other drugs as well can lead to kidney failure. Okay, let's just take the cocaine. The cocaine can cause your blood vessels to tighten or to constrict, and they can cause you to have a severely decreased blood flow to your kidneys, which can lead to kidney failure. Also, that cocaine can lead to very high blood pressure, dangerously high blood pressure, which can lead to kidney failure. I've had patients on dialysis and who've needed transplants only because of the cocaine. Heroin as well. Heroin can cause kidney failure for many reasons. Well, one of the reasons is that it can be mixed in talc and other substances that are actually nephrotoxic. So there are many reasons why you should not indulge in illicit drugs and excess alcohol. But let's just add this to the list, because alcohol and illicit drugs can cause kidney damage. These are just some of the medications and drugs that can cause kidney damage. Again, we know that medications can be very helpful, and even some of the medications on my list are ones that I prescribe to the right patient. But it's important that you at least understand that some of these medications can lead to kidney failure so that you can protect yourself and your loved ones. If you found this video to be helpful and informative.
So I played that whole thing, and I know it's a little lengthy, but I don't usually play long videos. I give snippets of them. But I couldn't get away from all the information she was dishing out. I get a lot of stuff from Dr. Frida, so definitely look her up on YouTube. She not only gives us this information about the drugs, but she talks about the diet. She shows you, and she talks about looking at your labels and all that kind of stuff. So your diet makes a difference. That's why I'm saying, is it reversible? Do we have to get to stage 5? And if we're at stage 5, is there anything that we can do? Or even a person who's on dialysis, what kind of foods should they be eating? A carefully managed diet can significantly help with CKD, chronic kidney disease, by slowing its progression. All of a sudden, your doctor may say you don't have to be on it as long because you are doing something about it. You are being your own advocate, as she constantly said, preventing further kidney damage by limiting the intake of certain minerals like potassium, phosphorus, and sodium, which impairs kidney struggle to filter effectively. Guys, the job of the kidney that God made is a filtering agent. And when it's not filtering properly, and I've seen videos where they say, well, you don't need to detox or anything because your body already has its filtering agents like your liver and your kidney. But what happens when it's not operating at its optimum performance? So there's this thing called a renal diet, which centers around what? Eating fresh foods, cooking from scratch, more often than eating prepared or fast foods. And you know we've talked about all the stuff that is not good for us, all the stuff that has the MSG and all the stuff that's in the package, in the book, in the box, in the can, in the jar. We've talked about that. All the things that are high in sodium. We can do something about it. You also need to use less salt in your cooking. Learn to season your foods with herbs and sodium-free seasoning. I'm the first person to tell you, I'm not eating it if it does not taste good. But I've learned, like today, I fixed hearts of palm, that it tasted like a salmon croquette. But seasoning, highly seasoned with things that are not salty, herbs and paprika, you know, all these kinds of things, wonderful things to season your food with, to help promote optimal kidney function and reduce the kidney's workload. That's what's leading us to kidney disease, because we're overworking the kidney. And we're overworking the kidney based on the foods.
Let's talk about the 7 best foods to prevent and reverse kidney damage. The kidney is a filter. This one on the left is a dirty kidney. This one on the right is a clean kidney. We're going to show you how to go from this to this using foods. I think the biggest myth about the kidney is this topic of potassium. I don't know how this started, but people tend to think that potassium is really bad for the kidney. You have to avoid potassium foods if you want to protect the kidney. That is absolutely not true. Potassium actually protects the kidney from damage. The only time you wouldn't want to take potassium is when you started to get advanced stage kidney disease. You need to consume a lot of potassium since our bodies require 4,700 milligrams a day. A couple ways that the potassium helps the kidney, other than directly protecting kidney damage, is this: potassium lowers your blood pressure. And having high blood pressure is one of the main things that destroys the kidney. If you have an imbalance with sodium and you don't have enough potassium, that can also be hard on the kidney. The way to handle the sodium on the kidney is simply to increase your potassium. Potassium can help protect you against kidney stones because it can lower the incidence of oxalates binding with calcium. The real bad things that damage the kidney: number one, and this is the biggest one, consuming a lot of sugar, starches, things like that, because all that sugar in your blood ends up in the kidney and it creates a lot of oxidation. And you can visualize that as something that's rusting out the kidney, damaging that little filter. Other things that will destroy the kidney: alcohol, NSAIDs like ibuprofen, medications. A lot of medications are synthetic, prednisone, or even antibiotics. Getting too many pesticides from the foods, heavy metals, food dyes, and too much phosphorus from soda, really damaging to the kidney. Being in the right diet with enough vitamin D and potassium and even magnesium can greatly help that. I'm going to show you all the different foods that you should be eating that can help reverse a lot of the things I'm talking about. Number one is really a category of key vegetables that are really important with kidney function: asparagus. Some people don't like it, but if you can consume it, it's really good for the kidney. It has a certain enzyme that helps to detoxify the kidneys. The next vegetable I would recommend is celery. Celery also has things in it to greatly improve kidney function. Bell peppers are loaded with vitamin C and a lot of other good nutrients for the kidney. Cabbage is another really good vegetable for the kidney. Cauliflower is another great vegetable. Garlic is loaded with allicin, which is really good for kidney function. There are plenty of other vegetables, but these are the ones that are very low in something called oxalates. Spinach is high in oxalates. You can have spinach, but I would recommend having it with cheese because those oxalates could irritate the kidney. And the most common kidney stone is calcium oxalate stones. And one great remedy for that is increasing your magnesium. This is number 2, magnesium-rich foods. Pumpkin seeds, anything leafy greens, avocados are all high in magnesium. I would, as a side note, also consume magnesium glycinate, at least 400 milligrams per day, because that magnesium also helps protect the kidney, and it does a lot of additional things for the kidney indirectly. Number 3, probiotic foods. Kefir, yogurt, sauerkraut, kimchi. On top of that, there are 2 microbes that have a unique property helping increase a certain enzyme to get rid of excessive urea, which is a waste product. The first one is Lactobacillus casei and Bifidobacterium longum. Both of those have been extensively used to help take the stress off the kidney. I would highly recommend them. Number 4, having not just a high quality protein source, also not overdoing it. Adding more protein could stress it out a little bit more. If you're seeing excess waste from protein in your blood or your urine, you're consuming too much protein. Cut down the amount of protein. You don't want to go low. You want to go a moderate amount of protein. Maybe you do 6 to 7 ounces per meal. And as far as the source goes, wild-caught fish, sardines, and cod liver would also give you the omega-3, and that's good for the kidney as well. And then also eggs. Number 5, high antioxidant foods. Blueberries, blackberries, raspberries, strawberries, beets are really good for the kidney as well, to counter some of this rusting out effect that happens just having high blood sugar or other things. Number 6, quercetin. Quercetin has some really great properties for the kidney, and the best source of quercetin is white onions, red onions. I consume a lot of onions, and you can saute them, eat them raw. Quercetin has an anti-inflammatory effect. It also then will prevent scar tissue in the kidney. It tends to put the fire out if there's oxidative stress. So just cook your eggs with onions or add onions to the meal. And number 7, extra virgin olive oil. When it comes to olive oil, there are certain things in olive oil, certain chemical compounds that are just dynamite for inflammation, kidney support. And it's even good for kidney stones. And I've sampled a lot of different olive oils, and there's a lot of good ones out there. And of course, my favorite is the one from Italy. I will put a link down below of the one that I use. It's off the charts as far as quality. As far as drinking liquid, it's also true if you're consuming too much liquid, that's not good for the kidney because it causes the kidney to work too hard. You need that sweet spot right in the middle. One additional little tip I'm going to recommend when you drink liquid, pre-make some tea. Keep it in the fridge and consume tea as your main liquid, because the polyphenols in tea do a lot for the kidney. These polyphenols also can bind with excessive iron that can damage the kidney. And of course, I'm not just recommending getting the tea that has the most caffeine or any caffeine, but there's a lot of different teas that can help the kidney. Green tea, but if I'm not mistaken, green tea might have caffeine, so you might want to not overdo that one. Nettle tea is a great anti-inflammatory tea. Dandelion tea is really good as well. It'll help act as a diuretic to get rid of excess fluid. Turmeric tea, or even a black tea that is naturally decaffeinated. The last point I want to make is think about this. The kidney is a filter of your blood, and you're eating food frequently. It is going to overtax the filtration. It's not a bad idea to do intermittent fasting to support the kidney for 2 reasons. Number 1, you can decrease the stress on the kidney by just not forcing it to work so hard. And secondly, intermittent fasting will drop insulin considerably to the point where your kidneys can start to heal, because one of the big culprits for damage to your kidney is too much insulin. You definitely want to do a combination of low carb, intermittent fasting with this program. And if you want information on that, you can check out this video on fasting right here.
All right, I'm going to stop. I'm not finished. So I've got to make this one in 2 parts, because I always try to keep this to be an hour or less. And I've pushed over an hour today. So I'm going to stop, and we're going to do part 2 of this next week. Next week, we'll be talking strictly about all the foods, even more foods, because I've got some other people that are sharing foods that are best to help to stop the kidney disease, to prevent the kidney disease, or to reverse the kidney disease, or to at least slow it down, slow down the progression. I hope this has been a blessing to you. Like I said, I don't usually play long videos, but I needed you to hear Dr. Frida, because she was giving that information, and too many of us in our culture are on all of these medications. And it's not the fact that we shouldn't use medicine, but it's the fact that we're living with it. As we talked last week, medication has become the new subscription that we're on for life. When we have other things that we should be doing, taking control of our own lives, changing certain things in our diet. Am I saying you have to become a vegetarian or a vegan or a plant-based eater? If you choose to do so, that's wonderful. But what I am saying, we've got to do something. We've got to make certain lifestyle changes to turn around the course of life, the direction that we've been going. Thank you for being here today. Listen, be blessed.